Hello, everyone. Hello, Ms. Cobb. My name is Dwayne Bio, and this is my presentation. First things first, I want to apologize about my hat. I know you like me looking professional for our personal reasons, but I'm trying. I don't got a barber, so you're going to have to deal with it today, okay? So my topic of discussion today is CTs and their fight against COVID-19, coronavirus, Rona, whatever people are calling them, whatever is causing people to be at home with their families. That's how I see it. I actually feel like it's like a good thing, good and bad thing at the same time. So COVID-19, where did it exactly start from? COVID-19 actually started from, it's the second coming of a virus called SARS in 2002 in China. SARS stands for Severe Acute Respiratory Syndrome, okay? Coronavirus itself is actually a virus that it's a common virus. It's a very benign symptoms as far as, I want to say, common cold, a dry cough, a small headache, a little fever, and it's actually mutated from bats into humans, and it's came from China all the way to America and caused this global pandemic that we have today, the reason why I'm doing this video in front of you today, okay? So as far as that all to be said, who is more susceptible to what's going on? And that would be the people that we love the most, as far as our grandparents, grandma, grandpa, the people that raised us from when we were yay high. And we want to keep them as safe as possible. Even though at least 80% of people don't have any symptoms that are just like crazy, you still can pass them on to the people that I just talked to about earlier. And it's actually having a strong hold on all that. That's what the big problem is in the first place, okay? People that aren't as susceptible to this whole thing are the younger kids, anybody from 1 to 9. I also read that healthy pregnant women are no cases of healthy pregnant women with COVID-19, even though me personally, I've seen how they treat the women that do have or supposedly have COVID-19. They're already isolated away from everybody, as well as their babies are too, which is actually kind of a sad scenario. Aside from that, the whole upbringing of COVID-19, what I mainly want to talk about is the role of CTs and how they play in this whole thing. So with CTs, that actually were one of the more important imagings when it came to the I don't want to say that word. When it came to imaging, as far as this whole thing, it started off in China in the early cases because it was more sensitive than the actual real test. Because you can't test for COVID-19 with CT scans. You actually test. It's a test called RT-PCR. It's a test that you see on TV with the people with the all white PPE on and the mask on. They sticking the stuff up your nose just to get the actual testing for COVID-19. So what actually happened was it didn't have that much sensitivity, so that's where CTs came into play. And you can only use CTs for help with management or to actually see what's going on. So when they actually played their role is when a patient would come in with the more severe cases as far as pneumonia or the cough. You know, people are scared, so they want to see what's going on. So you come in there, ask for a drum roll, please, a CT scan or a chest x-ray. And what these people are seeing on the CT scans, because it's more detailed, they're seeing 3 findings. One of the main findings that they're seeing is called, ground glass opacity. So imagine like starting your car and you have to cut on a defrost in the wintertime, right? So you got that fog, that grayish fog, and that's what they're finding in the lung lobes of these patients. Like it look really small, like almost like a little jelly bean inside of your lungs. And for more severe cases, those jelly beans are starting to expand, and it's what's called a white solid consolidation, which is giving a lot of problems to these patients. And to more severe, the more, pray for all of them, the more severe cases is when they're having this outlining inside of the lungs, which they call the crazy pavement pattern. Imagine like the stones on pavement at those crazy drive-throughs that look ridiculous. That's what's happening inside of the outside walls of these lungs, and it's actually causing people's blood pressure to drop down and cutting off all oxygen inside the organs and just like that. Me personally, I've been inside of there. Things to be going normal, and then just alarms be coming out of nowhere with these patients that are being ventilated. It's actually a scary sight, and it's, like I said, and that thing that I did for this school is actually very humbling to being able to see a lot of the stuff that's going on. It's crazy. But anyways, back to the topic at hand. As far as the early evidence, it's crazy because this stuff doesn't happen until around, you can catch it, and it doesn't happen until around the 7th or 9th day. But they're sending people home, so not being able to see it because it's just pneumonia, you know. 3 or 5 days at the hospital, you got to get out of the hospital. It's expensive, so I feel them. And people it's just being spread all over the place, and it's really traumatic to say the least. So around 7 or 9, that's when these ground glass opacities are starting to happen, and it's starting to get bigger and bigger, and then everything's being shut off in these later evidence cases, and that's where CT has actually been able to show the world what's been going on and how they can help solve the problem. Aside from that, me personally, to bring all this to a summary, I feel like CTs have a big role. No matter how many people try to take away, everybody has a role. Not just CTs, not just the medical field. You do. Your friends do. Stay safe. Stay out of trouble. Stay out the clubs. Like, actually take this stuff seriously. Because me actually seeing this in person is actually very sad. Seeing patients having a video chat their families from a bed on their birthday. I've seen a lot of people pass within these last couple of weeks. It's crazy. So please, I would like and require everybody to pay attention and take this stuff very seriously. This is not no type of conspiracy thing. This is the real deal. Let's, I don't know if everybody's religious. I don't want to put everything on anybody, but just pray. I was watching a blog the other day, and a man said that he put a football in his hands. It's worth $9. You give it to LeBron James, and it's worth $10,000. You put a basketball in my hand, it's worth 15. You give it to Michael Jordan, and it's worth $1 million. You try to put this whole situation in your hands, and you don't get too much out of it. You put it in God's hands, and it's priceless. So I advise everybody to stay safe, pray, and find yourself. That is my conclusion.